Saskatchewan Premier Scott Moe says he's heard from a few groups who are critical of the government's vaccine rollout plan. He says right now, health officials are looking at making some revisions as to potentially include more healthcare workers into phase one.
I've heard over the course of the last while some concerns from a number of healthcare workers about not being part of the phase 2 sequencing. And as you know, many healthcare workers are included in phase 1. And our officials are now working on any revisions that may be necessary to potentially include some additional categories of healthcare workers in phase 1.
Dr. Saqib Shahab defended the government's plan. He says national guidelines are based on a wide supply of vaccine. He says that doesn't exist at the moment, and that's why there's a need to prioritize those who are facing the most severe outcomes.
But at the end of the day, with the supplies we have, I think the biggest impact is moving down based on age-based criteria. And obviously, it's not an easy decision. But, where are you getting the most impact out of your vaccine right now with constrained supplies? It really is based on age. And that's where, it's 80 plus and moving down age group 70 plus and 60 plus. But obviously, as vaccine supplies increase, all these other considerations will have to be looked at very closely.
Moe is hopeful that the vaccine supply will pick up. The government is expecting 3,000 to 4,000 doses a day by mid-March, and then double that number in April. Manitoba's government announced the purchase of 2 million vaccine doses from a yet-to-be-approved Canadian manufacturer. Moe says the Saskatchewan government will not follow suit for now.
I actually had a conversation with both Premier Kenney and Premier Pallister. I did last week. On this specific company, I believe Providence is where Manitoba has procured some vaccines, and it's not off the table for Saskatchewan as well.
Moe also addressed the issue of rapid tests. The NDP criticized the government for not using rapid tests to identify cases in places like schools. Moe agreed, saying we need to do better. He says the government has received hundreds of thousands of tests and will start sending those tests out to places like schools, correctional centers, and Indigenous communities. Adam Hunter, CBC News, Regina.